Hi, I'm sitting with a person who could have prevented my mother from requiring major surgery 2 years ago. My name is Dan Modiano of the Levron Business Video Network, and I'm here with Osteopathic Dr. Daniel Lopez, who uses his hands to examine the bodies of his patients. Dr. Lopez, how does that differ from what most doctors are doing?
Well, even though there's plenty of circumstances that surgery and medications are warranted, osteopathic manipulative medicine, or OMM, can at times be used, if appropriate, to replace or reduce the need for surgeries and medication. Now, OMM is a hands-on treatment given by osteopathic physician based on the principles of osteopathy.
That's not a term I'm familiar with. Would you be able to explain it to me in the audience?
Yes, the principles of osteopathy state that one, the body, that structure and function are interrelated in the body. Two, that the body works as a unit comprising of mind, body, and spirit. Three, the body has self-healing inherent mechanisms. And the last principle states that rational treatment is based on those previous three principles.
And for what purpose would a patient come to see a doctor like you?
Generally, people come to me for aches, pains, headaches, injuries, sinus infections, and many other ailments.
Do you have any specific goals when they come to see you?
Yes, what I am trying to do with my patients is to maximize their health as best as I can, and that often requires a holistic approach.
What reasons would you be able to give our audience as to why they should come to see you as opposed to a conventional doctor?
Well, my treatments tend to be gentle, they're individualized, they're non-invasive, and most importantly, the results are permanent.
Are any of your methods unique?
Yes. Other osteopathic physicians and chiropractors often tend to use more aggressive techniques, and speaking for myself and not other osteopathic physicians or the osteopathic profession, I haven't found the more aggressive, forceful techniques to give me long-lasting, permanent results, which is what I'm looking for with my patients.
Would you be able to give an example of something that you do that might differ from a standard doctor?
Yes, a common practice is to force a bone back into its place, and oftentimes this doesn't fix the problem because the underlying problem hasn't really been addressed, and what that is another structure that is keeping that other joint or bone out of its normal positioning.
Dr. Lopez, it sounds like you have a very viable message that deserves to be heard, and what you're going to like about the Levron program is that we're going to be tapping into the social media networks of all of our members, which means that the audience could grow into tens and even hundreds of thousands. What we ask you to do is endorse them as they do the same for you. And by this give and take method, it could just have phenomenal results for everybody who participates.
Well, thank you. I certainly appreciate you helping me with my ambition to use my knowledge to help and improve the health of viewers who may be interested in trying out my services and resolve their problems, whether that involves surgery or medications or not, and preventing those.
And Levron, of course, also has an ambition to drive business to its members in every possible way by bringing new members on board and having them work together in a way that's a very powerful networking model where we're going to be combining both physical and social networking methods. Thank you. Thank you for being with us today, Dan. I appreciate seeing you.
Thank you.